The truth about Lyme disease. Why repeated myths keep patients sick. One of my patients had been told over and over again that a negative Lyme disease test meant she didn't have Lyme disease. That 1 month of antibiotics should have been enough. That chronic Lyme disease wasn't real. She believed it because she had heard it so many times. She assumed she had to just live with her symptoms. She was exhausted, struggling with brain fog and joint pain, but every doctor she saw told her that Lyme disease wasn't the problem. But when we took a closer look, we found something else. Her test had been negative, but her symptoms and history painted a different picture. She had all the hallmarks of Lyme disease, along with untreated co-infections like Babesia and Bartonella. The problem wasn't that she was imagining her symptoms. It was that her doctors were relying on outdated, oversimplified guidelines that ignored the complexities of Lyme disease and its co-infections. You've probably heard this before. A negative Lyme disease test means you don't have Lyme disease, or 1 month of antibiotics is enough. Maybe even chronic Lyme isn't real. The first time you hear it, you might hesitate. It doesn't quite sit right. But then you hear it again and again until eventually it starts to feel true. This is called the illusion of truth effect, a cognitive bias where repetition makes information seem factual, even when it's not. It happens in politics, marketing, and yes, medicine. The problem, repetition doesn't create truth, it only creates familiarity. And when something feels familiar, we assume it must be true. This is how myths persist, especially in medicine. It's why outdated ideas about Lyme disease continue to circulate, despite growing evidence that challenges them. This isn't just one patient's story. It happens over and over again. Patients with persistent symptoms are dismissed. Diagnostic tests that miss cases of Lyme disease are treated as infallible. The idea that Lyme disease is always a straightforward, short-term infection is repeated so often that it becomes ingrained in medical culture, even when the evidence says otherwise. So here's the real question. How much of what we know about Lyme disease is just something we've heard of too many times, and how much of it is actually true? The reality is Lyme disease is complex. The bacteria that causes it, Borrelia burgdorferi, are highly adaptable. They can evade the immune system, persist in different forms, and spread to multiple organ systems. Standard Lyme disease tests don't always detect the infection, especially in early or late stage disease. And for some patients, a month of antibiotics simply isn't enough. We need to move beyond repetition-based medicine. Lyme disease should be diagnosed clinically with a careful look at a patient's history, symptoms, and potential exposures, not just a lab test that can miss cases. We need to acknowledge that some patients do require longer or combination antibiotic therapy. We need to recognize that co-infections complicate treatment and that Lyme disease doesn't always fit into a neat, one-size-fits-all model. More importantly, we need to question what we think we know, because sometimes the things we've heard the most aren't the things that are actually true. And when it comes to Lyme disease, believing the wrong things can mean the difference between suffering and healing.